Nursing homes, the epicenter of the coronavirus pandemic.
We've got a population in nursing homes that is more susceptible to getting sick.
An NBC 10 investigation found before COVID-19, facilities across our area cited again and again for infection control violations. Staff not washing hands or wearing gloves or masks.
The most fundamental thing that needs to be done to prevent infections for all of us.
The vast majority of violations carry no substantial penalty.
We've known it's a serious problem, but we haven't treated it seriously.
In Pennsylvania, more than 60% of all COVID-19 deaths have been people living in nursing homes. We've seen outbreaks in what the Centers for Medicare and Medicaid consider five-star facilities and in some that have no stars.
The NBC 10 investigators looked through inspection reports for nursing homes of all levels, finding infection control violations that resident advocates say have been overlooked for too long. Mitch Blocker with the story.
Antonia Rico Salvador died on April 3rd. The 93-year-old suffered respiratory failure after testing positive for COVID-19. She had been a resident at Broomall Rehabilitation and Nursing Center.
It was time. It was time. But it wasn't time for others there, you know, and that's the thing that really bothers me.
Antonia's daughter, Annabella George, says she was immediately concerned about her mom infecting others.
I was really worried about their staff and about the other residents there.
The Pennsylvania National Guard was at the Broomall Rehabilitation and Nursing Center to help with staffing. According to the facility's owner, 60% of residents have tested positive for the coronavirus. At least 28 died from it, including Antonio Salvador.
I think that they did not have those proper protocols in place.
A spokesperson for Broomall Rehab says due to patient confidentiality, it can't comment on one case, but added, quote, "We understand and greatly appreciate family members' concerns for their loved ones and are doing everything in our power to keep our residents safe and protected." Inspectors from the U.S. Centers for Medicare and Medicaid Services cited the Broomall Center 3 times for violating infection control regulations. The violations occurred between 2017 and 2019, before the COVID-19 pandemic. The most recent violation took place in November 2019. It involved 2 employees not properly using gloves or washing their hands while treating 2 residents. In a statement, the facility says the violation was cited as minimal harm, and it was back in compliance in January. The older violations were also addressed when they occurred. We also found similar stories as we dug through 5 years of nursing home infection control violations. In Philadelphia, 79% of nursing homes have had at least one of these violations. In New Jersey and Delaware, we found some nursing homes with as many as 4 and 5 violations since 2015. From employees not washing their hands to not using gloves or other PPE properly and failing to disinfect medical equipment between uses. These mistakes don't carry much weight. The vast majority don't rise to the level of a fine on the inspector's violation scale. Between January 2015 and January 2020, federal inspectors issued 20,993 infection control violations. 99% of them were classified as no actual harm. The Centers for Medicaid and Medicare Services declined our request for an interview, but did send us a statement that reads in part, many citations for infection control are lower-level deficiencies because in the majority of these cases, surveyors have cited facilities for non-compliance with infection control standards that could lead to resident harm, but have not yet, such as hand hygiene practices.
They're not low-level violations. They shouldn't be called low-level violations.
Toby Edelman is the senior policy attorney for the Center for Medicare Advocacy.
Infection control problems are very, very serious because we're talking about a very vulnerable population in nursing homes.
According to the Center for Disease Control's website, as many as 380,000 people die of infections in long-term care facilities every year.
So we've known it's a serious problem, but we haven't treated it seriously.
Edelman wants tougher penalties.
To really get attention of the facility, gear the amount of the fine to the level of the facility's violation of standards of care.
She also believes a nursing home's past inspections might provide a look at its ability to stop infections today.
It could be a clue that there's a problem. If the facility has had an outbreak of infection before and hasn't changed its practices to make sure we don't do that again.
I can say that all of our members follow regulations as closely as they can.
Adam Marles is the president of Leading Age PA. He advocates for nonprofit long-term care facilities in Pennsylvania.
No, I don't think that there is a direct correlation between past performance and spread in the current crisis.
You don't think that it might have shown a warning sign that maybe something needed to be cleaned up?
Again, in certain cases, perhaps, but it's not a universal truth.
Inspection records do show some nursing homes without past infection violations have had residents die from the coronavirus. Marles also says he doesn't think more fines will make nursing homes safer.
The idea of saying that that taking more money away is going to help when what they really need is better compensation and more supplies and more PPE is going to run counter to what we're trying to accomplish.
The Centers for Medicare and Medicaid Services tell us during this administration, we have seen the number of nursing homes with enforcement actions increase by 15%, and the total number of civil monetary penalties collected increased by 22%.
You've got to do quality oversight, and you need an intensive focus on infection control.
U.S. Senator Bob Casey sits on the Senate Committee for Aging, which oversees nursing home regulation.
Do you think that infection control violations are low-level violations?
No, I think you have to treat any kind of infection control problem as a significant threat to the residents of a nursing home.
In March, the senator introduced the Coronavirus Relief for Seniors and People with Disabilities Act. It includes nearly $45 million for infection control inspections and prevention.
If we want quality care, we got to be willing to pay for it.
But something needs to change.
Annabella George is concerned that these problems existed before COVID-19, but what's learned from a pandemic can fix them.
I do believe it's a systemic problem in nursing homes that has to be addressed.
For the investigators, I'm Mitch Blocker, NBC 10 News.
The U.S. Centers for Medicare and Medicaid Services says it continues to work with the CDC to fight coronavirus in nursing homes. It's still conducting some inspections looking for infection control violations. And one problem everyone seems to agree on, nursing homes continue to face staffing shortages. The industry has asked both state and federal governments for billions of dollars to spend on supplies and staffing. Pennsylvania has released the names of nursing homes with COVID-19 cases and deaths now. We've posted it for you. You'll find it at nbc10.com/nursinghomes. Back to our coverage of the pandemic. Long-term care facilities continue their battle on the coronavirus front lines. The industry is now asking both state and federal governments for something, and it's raising concerns among resident advocates, family members, and also lawyers. NBC 10 investigative reporter Mitch Blocker explains what they're asking for and why some are against it.
She was fun-loving, loved life, loved everyone.
Robin Konofsky turned 63 on May 2nd.
My wife is the most generous, sweet person I've ever met.
Her husband, Stuart, can't believe just weeks later, she's gone.
I see her the same way in heaven right now. And she's getting along great because they want the best people there.
Robin was a resident of a local nursing home. She was rehabbing from complications due to a stroke. When CDC regulations closed nursing homes to visitors, Stewart improvised.
I would come around every day to her window and sing to her and speak to her in the window.
Then he heard Robin's roommate tested COVID-19 positive. But Stewart says the nursing home didn't immediately move his wife out of the room.
They never moved her Friday. They never moved her Saturday. They never moved her Sunday.
He says Robin was eventually moved that Monday. Days later, she tested positive.
She's got a high temperature.
Robin was taken to the hospital, where she passed away.
They failed her.
Now Stewart plans on suing the nursing home, and it's potential lawsuits like his the industry is working to prevent, asking states and federal governments to grant civil liability immunity to long-term care facilities during COVID-19.
Nursing homes did not cause this virus. There was no way that nursing homes could have kept this virus out of their buildings.
Mark Parkinson represents around 14,000 mostly for-profit nursing homes across the country.
It's really unfortunate that even as we're battling this crisis right now, the lives and deaths of staff and residents in these buildings is at risk right now, that already these lawsuits are being filed. I think honestly, it's pathetic.
The idea that that plaintiffs' attorneys will bring suit against members, against facilities during the crisis when they're doing everything in their power to keep people safe is truly problematic.
Adam Marles represents nonprofit nursing homes in Pennsylvania. He and Parkinson say the lawsuits could financially cripple the industry, impact staff members and quality of care.
If they need to be worried in the background during a crisis about having to be called into a deposition and having to be dealing with a lawsuit on the back end, adds to that stress.
In Pennsylvania, Governor Wolf signed an executive order only protecting practitioners from lawsuits. Some other states, including New Jersey, have granted immunity requests with legislative action or executive orders covering both workers and owners.
You've taken away the last vestige of potential accountability for nursing homes just at the time when residents need more accountability, not less.
Richard Mollett runs the Long-Term Care Community Coalition, an advocacy group for residents.
The only threat of accountability we have is the specter that a facility could possibly be sued if its care is so egregious that it fails, that residents die, residents suffer.
If there's misconduct, they have to be held accountable.
Christopher Culleton is an attorney who represents nursing home residents and their families. Stuart Konofsky is one of his newest clients. Culleton doesn't think there will be many COVID-19 lawsuits.
There will not be an avalanche in cases relating to COVID, because in most situations, there will not be evidence of misconduct. It will just be a bad outcome that can happen. People can get sick, people can get infected.
He believes granting immunity to workers is a good idea.
It will encourage practitioners to work. I know there will be problems with staffing. It will encourage people who are retired or people who are now part-time to go back and help.
But the owners are a different story.
I'm anticipating that what the industry will try and do is they will try to leverage the sympathy and concern and risks associated with COVID to get immunity for these other claims too.
The idea behind civil immunity isn't that we're trying to get away with anything. We want quality of care above all else.
We would talk about life when she's coming home, about recipes that she loved to cook and I would cook. We'd cook together.
Stuart wants accountability for his wife's death, but also wants people to know they have to advocate for their loved ones living in long-term care facilities.
She's up there, so I know she's watching me.
For the investigators, I'm Mitch Blocker, NBC 10 News.
The attorney, Culleton, says his firm is still investigating Stewart's case. With nursing homes on lockdown and the courts closed, any lawsuit is in limbo until things reopen.